without any further ado, I'll hand over to Louise and listen to an interesting talk on UTIs. Over to you, Louise.
Thanks very much, Brian. If you bear with me just a moment and I'll share my screen and we'll get started. Okay, so I'll get started. So as Brian said, my name is Louise Hoolighan. I am the Stoma Nurse Specialist at the Golden Jubilee Hospital in Glasgow. Previously, I've worked in Edinburgh. So my experience in Edinburgh is where I've got my kind of urology experience. I've worked for about 18 years altogether in colorectal, but in my previous jobs, there was quite a lot of urology within that. I no longer work within urology. We don't have a urology department anymore, but obviously I do have a wealth of experience in managing both urostomies and other urology presentations. So just so that you know who I am. So I'm going to talk today about urinary tract infections. So firstly, what is a UTI? Essentially, we use the term urinary tract infection to describe an infection within the urinary system, which is usually the bladder. But obviously, when you have a urostomy and your bladder has been removed, a UTI normally relates to an infection within the stoma or within the ureters, which are the tubes that lead up to your kidneys. With a urostomy, you are at a higher risk of developing a UTI, just because of the nature of it and the fact that we don't have a bladder there, that we've got a lot less of the urinary system there. So it's much more likely to develop a UTI. And it's also a shorter distance to the kidneys when we don't have the bladder there. So it's much more likely that we can develop a kidney infection if we start off with a UTI further down that tract. So just thinking about the symptoms that you might see, how would you know if you have an infection? So unlike someone with a bladder, you won't get the usual symptoms of urgency, frequency, or a burning sensation. What you might get instead is dark, cloudy, or strong smelling urine, which it might be tinged with blood, so it might just be a slight pinky colour. Pain around your stoma or kidney area, so in the flank or the back. A raised temperature, feeling feverish or clammy, almost a bit like a flu-y kind of feeling. You might feel a bit confused, or others around you might notice you're maybe a little bit confused when you're speaking, maybe using words that aren't appropriate in that sentence, for instance. And feeling tired and just out of sorts, just something's not right. You can't put your finger on it. And if you tie that in with any symptoms that you notice with the urine, that obviously hints at a urine infection. So what might you do if you suspect that you have a UTI? The first port of call really is to speak to your GP. Early intervention is key. As I spoke about, you are much more likely that an infection can reach the kidneys. So we want to avoid kidney infection and obviously sepsis, which can be very serious and life-threatening if it develops further and further on. So the quicker we get intervention, much, much better. So speaking to your GP, first of all, explain your symptoms to them. You know, obviously when we phone GPs nowadays, we don't get through to a GP, we get through to a receptionist, and we have to explain the symptoms there. If you say that you have a urostomy, well, as you're explaining your symptoms and that you are prone to infections, you will definitely be then pushed through the system to get further on to speak to a GP or a nurse who can then organise urine samples, etc. When you're explaining your symptoms, sometimes I know I get quite nervous when I go into the GP practice and I forget things. I forget to tell them everything that I want to say. So what I find really useful is to write everything down. So write down your symptoms, write down what makes you suspect you have that urine infection. That way, when you are speaking to somebody either on the end of the phone or in the GP practice, you're not going to forget what you need to tell them essentially. So once you go to the GP practice, or perhaps before you go to the GP practice, they might ask you to bring a urine sample with you. If you're asked to take a urine sample, what that is going to do, it's going to help to detect any infection that's there and also what strain of infection that there is. The key thing is to remember never to take a sample directly from the bottom of your stoma bag, your urostomy bag, because this is often contaminated. So what you want to do is take your bag off and clean around your stoma firstly. Hold a clean specimen pot under the stoma to collect the sample. You want to avoid the specimen pot touching the stoma or the skin, because that can sometimes contaminate the sample pot, which then contaminates the specimen. Collecting that specimen can take some time. Obviously, you'll know with your urostomy, it will be a slow trickle usually into the bag. So what you want to do is just be very patient, make yourself comfortable, and allow that to just trickle into the pot. If it's not possible to collect it in that manner, so you might have a stoma that is much more flush to the skin. It's not got a very good spout on it, for instance. Or just because of your anatomy shape, perhaps it might not be possible to take the specimen in that way. So another way to do it is to change your bag to a fresh, clean one and keep the bottom of the bag open and allow the urine to drain into the specimen pot through the spout at the bottom of your bag. That way, we're much less likely to get contamination because it's a clean bag that you've put on there. Sometimes, however, if that is still causing contamination, you might be asked to go into maybe the GP practice or into the hospital to have a nurse or a doctor insert a small catheter into the stoma, which is completely painless there, and that allows the urine to be taken in a clean catch out of the stoma and into the specimen pot. All samples should be marked to say that the sample is from a urostomy specifically, because it's just important that they understand that, because obviously contamination and things can be slightly different when it's from a urostomy. So if it is determined that you do have a urine infection, obviously you're going to need some treatment. So the first line of treatment is usually antibiotics, a course of antibiotics. The urine specimen that you've handed in will help determine the correct antibiotics for the strain of the infection that you have. Many things can cause a urine infection, many different types of bacteria. So it's really important that that antibiotics is the right one to hit that specific infection. Initially, you're probably going to be prescribed a generic type of antibiotic, so just one that is kind of generic or kind of like the standard course for a urine infection. But once the lab results come back, if it points to a different antibiotic being more effective, you might then be asked to change to a slightly different antibiotic. And that is absolutely normal practice with a urine infection. Even if it wasn't a urostomy, it would still be the same thing. If you've handed in a specimen and it comes back with a different strain than expected, you might have to change antibiotic. The best way to treat from your own point of view is to drink plenty of water. Keep yourself well hydrated. That's going to help to flush out any bugs, bacteria that's in there. Paracetamol is quite a good one to take. That can help with both any pain that you're getting from the infection, but also it can reduce your high temperature if you have one. So quite a good easy source of pain relief and to help with the symptoms that you're getting. If you've started on antibiotics, you've been taking them for about 48 hours and you're not getting any effect from them, you don't think they're helping, or your symptoms are worsening rather than getting better, you should always seek further medical advice from your doctor. So we've spoken there about if you get a urine infection, we've spoken about the treatment that would be involved in how to get a specimen from the stoma. Actually, we don't want to get a urine infection in the first place. So how can we prevent a urine infection? So the first way is to keep hydrated. As I've said about the treatment, drinking plenty will help to flush out any bacteria that is there. So hopefully it's flushing anything away and it's not having a chance to grow within the urinary tract. Your urine should be clear to pale yellow, and that gives you a good indication that you're well hydrated. If it's very dark in colour, that's a sign that you're not well hydrated, so try to drink a little bit more. Avoid or reduce your alcohol and caffeine intake. Both of these things can dehydrate you, so you want to avoid that if you can, if you're trying to avoid a urine infection. Cranberries or cranberry juice can help some people to avoid urine infections. So if you are prone to them, it sometimes can be useful. Obviously, we do have to be careful because some medications like warfarin, which is used to thin the blood, can be affected by the cranberry juice. I believe it actually increases the effect of the medication, so it makes you much more prone to bleeding. So if you're on any medications that you've been told to avoid cranberries, obviously do avoid that. And if you're unsure if you're on any medication that might interfere with it, then speak to your pharmacist, your GP, or your stoma nurse if you're unsure. Emptying your bag frequently can also help to reduce growth of bacteria inside the bag. Essentially, the longer that the urine is sitting in the bag, the more time it has to build up the bacteria in there. So keeping it empty, keep frequently emptying it. So emptying when it's about a third to half full rather than waiting until it's completely full is usually best practice. Also, using a night drainage bag can reduce the urine building up in the urostomy bag overnight. So you're kind of drawing it away from the urostomy bag down into the night bag. And again, some people prefer to use a single-use night bag rather than one that is reused several times. Because again, you're throwing it away each day, and therefore any bacteria that does build up in the night bag isn't lingering there for any length of time. You're throwing it away and getting a fresh one the next night. So that is really everything that I had to say about urine infection. So what we'll do is we'll move on to questions. So if you bear with me a moment, I shall stop sharing my screen so that I can see any questions that have come up in the chat. So if you do have any questions for me, do feel free to type them in the chat. Once we've gone through those questions in the chat, if anybody does want to ask, I'm quite happy to take verbal questions as well. So I've just got one wee question here. So I think it's Bobby has said, as someone who has had their first stoma damaged by an over-enthusiastic nurse trying to get a catheter in, I no longer permit this. And that's absolutely fine. Obviously, everyone's anatomy is different. It is one way of getting, if we're struggling to get a clean catch of urine, it is one way to get a clean catch. But obviously, as I described, there are other methods of getting that specimen. So, if a nurse can't get it, if you need to have that clean catch and a nurse is unable to get it, it might be that a doctor or a urologist needs to be involved to help with that. Anyone inserting a catheter into a stoma should be well practiced in it, and not be inserting that if they're unsure of what to do. So it should be somebody who has that experience and knowledge. So we've got another question there from Brian, who has said, I've heard some people have a supply of antibiotics at home so they can start treatment ASAP. Is this worth considering? It's certainly not something that I have ever experienced with any of my patients myself. I guess people who have that at home must be particularly prone to infection to need that. it would be something that obviously a doctor would have to prescribe, or a nurse prescriber would prescribe for you based on your history. It's certainly not common practice as far as I'm aware, because obviously the more that we use antibiotics, if we use them inappropriately, so starting an antibiotics without that medical advice to say that we do suspect a urine infection, it can actually reduce the effect of the antibiotics as time goes on. So we need to be very careful with the use of antibiotics and make sure we're using it appropriately. But if someone does have, a severe risk of that infection, and somebody has, perhaps been immunosuppressed or things like that, there are certainly reasons why that might be appropriate to have that in the house, and start your medication as soon as possible. But I certainly don't think it would be just a standard practice.
Louise, could I
Um,
just come in there quickly?
yeah, of course.
Because I've actually done that.
Okay.
I did it mainly because we were going away for a 6-week break, and I wanted to take some with me just in case I had a UTI. But it was quite a rigorous discussion with the GP before he would allow it. But it does have its benefits. You can get started early.
Hmm.
If you've had them before regularly and you know you're going to get what the symptoms are, then
Yeah.
it does help. But it's not, like you say, it's not standard practice by any means.
No, absolutely. And I think, as you say, you've had a long discussion with the prescriber to decide that the pros outweigh the cons, and kind of worked out that that's going to be the
Sure.
best course of action for you. So it's certainly, something that can happen. I certainly know I've got a relative who has them. She has regular chest infections, and she keeps them in the house for that very reason, because the quicker she gets started on them, and she knows when she has that chest infection. So I guess it's the same kind of thing. But obviously it would be at the prescriber's discretion as to whether they felt that was an appropriate use of the antibiotic, and that it has to be used in a certain manner, that obviously we don't want to overuse antibiotics, because then, eventually these antibiotics become ineffective, and we become resistant, to these antibiotics, basically. Right, I've scrolled up too far and I can't find the next question. Bear with me. Here we are. So the next one is Tracy, who said, is it possible I could have an infection even if a sample comes back no growth? I still have the symptoms. That is a good question. I would have thought no, because if the samples are coming back as clear and there's no bacteria there, is it if it's just one single sample, it might be worth a repeat of that sample to see, maybe there just wasn't any of the growth of bacteria in that particular sample. So it might be worth repeating it to see if there is anything else, especially if you do have symptoms. But bear in mind, the symptoms are quite vague, things like the fevers, temperature, things like that. Cloudy or dark urine could also be dehydration. High temperature, fevers, all these kind of things could come from other sources. So I think if you have symptoms, it's something you would need to discuss with your doctor to see if there are any other underlying causes as well. Because obviously, if you're getting a sample back and it's negative, and if you repeat that sample and it's still negative, then the chances are that is not where the source of infection is coming from. So it could well be other things. The next one is from Ian. I haven't noticed smells, etc., but have had fever over 38 degrees, and in one case, rigors, uncontrolled shivering due to a fever, which sent me to hospital. I mean, obviously, there are varying reasons as to why you can have fever. It could be infection from other routes. It could be many different
Yeah.
reasons why. fever, and if you don't have specific urinary symptoms, then it could well be coming from some other source. So again, we have to remember that although you have a urostomy and you're prone to infection because of that, that doesn't necessarily mean that's what's causing the problem. So I think maybe other things also need to be ruled out. But the first course of action, if somebody has a fever like that and they have a urostomy, would be to send off a sample. So if you haven't had a sample checked, it might be worth speaking to someone about that to get that checked out.
I think in the first case, I had been on holiday and came back with the high temperature on the aeroplane,
Okay.
and then went to the GP, and they dumped me in an ambulance and sent me off to the hospital straight away. And that turned out to be an E. coli infection, which had got into my blood. So it was sort of dangerous. It wasn't sepsis, but it was, on the way potentially.
Yeah.
They never really figured out where the E. coli had come from. But a few weeks later, having apparently cured it, I got the same symptoms again, went back for a week. And at that point, they discovered what they called an infection in the upper urinary tract. So in other words, in the kidneys, little residual infection in the kidneys.
Yeah.
And I think I've had that again after a number of months.
Okay.
But so that's weird, because the same time there was no reading from the urine and no reading in the blood, but scans found this kind of little residual infection in the kidneys. So those symptoms are symptomatic of kidney infection as well as UTIs.
Yeah, absolutely. I mean, certainly, like I say, with UTIs, when you have a urostomy, it will travel much quicker to the kidney. So that is the worry, and that's why it is so important to keep a close eye. And I guess in some ways, having a urostomy bag with the urine right in front of you.
Yeah.
If you're weeing into the toilet, it gets diluted. You maybe don't notice a colour change or a smell change. But when it's in the bag right in front of you, you're much more likely to pick up on these changes. So in some ways, it can be helpful, but it will travel to the kidneys much quicker. So that's why being on top of it quickly is very important. And it certainly, E. coli is probably one of the more common bacteria that does cause urine infection. So the chances are, that is what was happening that first time as well.
Yes, I think so, probably.
If they've detected that E. coli infection. I guess one thing I didn't say in my presentation is hand hygiene, obviously, as a preventative as well. Washing your hands before changing your bag and after can help with the reducing the risk, because we all have E. coli in our gut. And when we, at low amounts, it is absolutely fine when it's in there. But it's when it becomes when that bacteria overtakes, that's when it becomes much more of a problem. And obviously, if it then transfers into other areas, that's where we tend to see that we get unwell quite quickly. So certainly hand hygiene is another way of prevention as well. Especially, I think, at home or kind of things like that, we tend to be very vigilant with it. But sometimes when we're on holiday and things like that, sometimes maybe the water isn't as clean as what we would normally be used to. So often boiling water, if you're unsure that water is clean, boiling the water first and letting it cool and using that for washing hands, or using bottled water, for instance, if you're unsure if the water is as clean as it could be, because sometimes it can be that's actually contaminated. Some people find when they're abroad, using like water-based wet wipes to clean around the stoma can also help with that, so you're not using the tap water to around the stoma too. So a few other little tips there that can sometimes help to reduce that risk there.
Thanks, Louise. I think we're going to have to draw it to a close there. We're going to run out of time if we're not careful. So thanks very much indeed for that input.